I feel that our role here in the pharmacy is to be supportive and to make sure patients understand their medications, the medication regimen, the protocol, as well as their administration technique. We do play a collaborative support system with the doctor's office and the patient and ourselves, and so our role is to be there in whatever process they need. So to be available with questions, to be available to have accessibility for their medications, and to support them through financial assistance if possible. Our fertility team goes through fertility-specialized training. We do online modules to have a recurser, and then we also have fertility training in person with a clinical nurse specialist. Additionally, some of us that have been in the field for a lot longer, we train other employees and we train other team members to be familiar and knowledgeable with fertility. When a fertility patient first comes in, or at times when they first call in and through the phone, we make sure that we let them know that we're here for them, that we're here to support them, and we go through their protocol. So we review the medications that were prescribed, the way they were prescribed, we go through some of the supplies, some of the side effects, and we ensure that any questions they have at the time are being answered. Additionally, we make sure that the delivery process is seamless. We make sure that whatever works for them, if it's to come in person or if it's to get it delivered at the home, we're here to support them in any way possible. As a fertility specialized pharmacy, it is important for us to make sure that we have medication availability in stock at all times. Due to the time sensitivity of these regimens, we need to ensure that we have it available. So it is important for us to make sure that we get the medication to the patient as quickly as possible when they need it, and to make sure that we have it in stock. So for example, when medications go on back order, we're continuously looking for resources to be able to provide that medication and have it here for the patient. We also provide same-day delivery because we know that it's time sensitive. So sometimes they need a medication in the evening that they just found out about first thing in the morning, so we make sure that we're available for them. When patients are ready to go ahead and process their prescriptions through us, the fertility medications, we want to ensure that they know that they're getting the best financial assistance possible. We do our research and find out which medications qualify for which programs and discount programs, and we ensure that we do the legwork and that we enroll them, we have everything ready for them. And with all the stress and uncertainty of the infertility diagnosis, we believe that this is one less thing they have to worry about. Depending on the level of knowledge on the infertility process that the patient has, we're able to provide additional education for them in regards to medications, monitoring for general side effects, and then just in general looking at administration technique. We do provide online resources for them to review the general review of fertility as well as the administration technique through video, but we're also here in person able to assist in both manners. So we could discuss the general description of what the medication is and what it's doing to the patient and what side effects to look out for, and then how to manage those side effects. So because the patient's fertility regimens are so intricate, patients tend to get very anxious and intimidated by the medications. And so it's important for us to be able to support them through the administration technique. For example, we have to instruct them on which needle to use for injecting versus mixing so that they're completing their therapy correctly. Fertility patients receive specific calendars with times and dates that they need to inject certain medications, and because it is a rigorous cycle, we want to make sure that the patient is injecting at the right time with the right medication. So adherence is very important in order to be able to have a successful cycle. We need to make sure that the patient understands that if for any reason there's a side effect that might be limiting them for continuing any certain therapy, that it is important for them to reach out to their healthcare provider to see if any changes in or adjustments in the regimen have to take place. With the local fertility providers that we work with, it's important to really understand their priorities and their needs. Many times we don't have to communicate regularly. We understand the provider's protocol, their expectations, what the patient's needs are, and we're able to assess and support their patients in that manner. There are other providers where we are maybe more of a resource for financial assistance for the patient, or they reach out to us for pharmacist expertise on certain medications. And so it really depends on the level of relationship that we have with that provider. We make sure that, I visit them regularly. I make sure they understand that we're here to support their patient. I love the face-to-face interaction, so I want them to know my team, and I introduce my team to them as well. But I think that it's important to understand what their priorities are and what I could do for them to close some of those healthcare coverage gaps and assess in that sense. From my perspective, I believe that the top concerns of the infertility providers are first, accessibility, making sure that the patients are able to receive their medications. Many times medications go on back orders, they're not available, and it's difficult to find these prescriptions for them. So the providers really want to ensure that their patients are getting their medications at the right time. Secondly, I would say one of the benefits of the healthcare providers working with the fertility specialized pharmacies is that we have fertility specialized trained pharmacists and staff that's here available to their patients. Additionally, we have same-day delivery and face-to-face patient interaction, so we're local and accessible to the patients to come in for a full run-through of their medications, as well as discussing medication administration technique, common side effects, or any other questions about resources like financial assistance that's available for them. One of the benefits of using a Walgreens fertility specialized pharmacy is that we are connected nationwide to all the other Walgreens. So we're able to look at a patient's medication profile and ensure that there's no drug interactions for that patient. We understand that the fertility journey can take a toll on a patient's mental health. We want to make sure they understand that we are here to support them. Our pharmacists are mental health first aid trained. And we also provide additional resources through our Walgreens website or our Walgreens app. We understand that patients undergoing cancer treatments may have additional concerns regarding their future fertility. Walgreens is here to help with fertility preservations through access and savings with onco-fertility programs, enabling patients to get their medications through one pharmacy. There are 3.9 million LGBTQ+ millennials in the coming years that will be building families, and we want to make sure that we are here to support each individual through their journey. Walgreens is proud to partner with Family Equality, which is a non-for-profit organization whose mission is to advance the equality of LGBTQ+ families and those wishing to build them.